Hi, it's Dr. Bartels. A lot of people want to know when is the best time to get intensive aphasia therapy. When is the best time to come to the Aphasia Center? And really, there's not a specific answer to that. It depends on your circumstances. Now, your doctors or your neurologists may say that you're going to make the most progress, or you're going to make any progress, 6 months. Some people will even go out to a year. But the truth is, as we all know, that you can continue to make gains years after you've had your stroke. That said, a lot of people like to get in to the Aphasia Center within the first 6 months of a stroke. However, I don't want you to think that you're a bad person or you're a bad caregiver if you can't get someone in here within the first 6 months. There are a lot of people who come here, some people a week after their stroke, some people 14 years after their stroke. So really, it all depends. My advice would be, do it when it's actually convenient for you. You want to get in, I would say, earlier versus later. And the reason for that is because there's a lot more that we can get done earlier. Later we can get some things done, but sometimes people have these very set behaviors or very set speech patterns that it's more difficult, takes a lot longer if you wait. That said, there are people all the time who call and they have small children, or they're in the middle of selling their house, or maybe the person with aphasia is having a lot of other physical difficulties. They need to learn how to use the restroom by themselves first, or get a little bit more independent in some other areas. Maybe they've got other medical issues like seizures, or they're trying to straighten out their medication. So don't think that you absolutely have to rush to get in here. So the answer to when is the best time to do intensive aphasia therapy at the Aphasia Center is when it's the best time for you. You know your schedules, you know how tired you are, you know what your physical status is like. It's important that you come early-ish versus late-ish, but there are a lot of people who call us and say, I feel terrible, I just found out about you guys, we should have been in here months ago. Don't think like that. There's only so much that you can do as a caregiver. You've got a lot of things going on, and the fact that you didn't know about intensive or you didn't do it right away, you should not bear that responsibility. That is not something that in the long run may have made a huge difference. This is Dr. Bartels. Thanks for watching.